Shrublands House and Walnut Lodge exists because people struggle with their drug use and they look for support, they look for guidance, and we're there to provide that service to drug treatment. Been around for a very long time, provided support for the people of Torbay, ongoing, and we're always there for people. My role is as an open access worker, so I'm the gateway into drug treatment for people of Torbay. I do initial assessment, so I meet with somebody, I will basically meet with them, explain the services we provide, and then I will get the ball rolling. So I'll ask the questions that need to be asked, get the details we need, and then link that person into drug treatment, either at Walnut Lodge or at Shrublands House. So my role is very much around that welcoming face, encouraging people to look at the situation that they're in and then finding a way forwards from that point.
The thing I love about my job is that when we first meet people, we're meeting them when their whole lives have been consumed by addiction. It's the only identity they know to exist in. But by working with them on an individual basis, based on their interests, their needs at the time and their aspirations, we see people re-engage with who they were or become a person they never knew that they could be. And that's wonderful to be a part of.
Gosh, we see all sorts of people here, all different ages. I mean, we're open to people from 18 to 80, and so we see people from different ages, different backgrounds, different life experiences, parents, people that are caring for people that have got drug or alcohol problems. We see anybody and everybody.
Drug use when people present, very varied. It can be the illicit drugs like heroin, cocaine, cannabis, amphetamine. We also support people having problems with medications being prescribed by their doctor. Also over-the-counter medication as well, people struggle with that. We also work with people around relapse prevention, so people have sorted out their drug use, they're quite okay, they've gone through detox, whatever it might have taken. But they've come to us to stay on that track, on that recovery, and relapse prevention is a key part. People that we see also, they'll come to me when we look at residential rehab as well, so going to that next stage. So as far as substance is concerned, it's everything that people struggle with, and there's no sort of judgment there, there's no sort of hierarchy. If you're struggling, you're struggling, and that's the key message really, is that people, once they've got to a point when it's all too much, there's people there to help.
So when we first meet people, we do a rounded assessment of needs related to substance use, related to health, related to social issues around housing or around family, and from then we can either offer solely one-to-one interventions with that person, looking at relapse prevention, looking at those issues that I've mentioned. We can also involve them in group work to build that peer support around them. We understand that when people first come into treatment, that's obviously quite an overwhelming concept, but we support people in overcoming that.
I love watching people make that journey, so they can come into this service in various states of use, whether it's drugs or alcohol, and watch that journey that they make. And me particularly, I work with volunteers, so I work with people that have been through our services, become free of drugs and alcohol, and they give something back, so they come and work alongside us and work with our recovery workers and help other people make that same journey again.
And I know the system, I've worked here for 12, 15 years roughly, and people do well in treatment, they do well, and it's seeing that little penny, that little sort of light at the end of the tunnel for somebody who's walked in, because they don't know what to expect when they come to open access. That initial meeting is very new, very sort of like sort of foreboding, I suppose, before you get through the door. And if I can just instill a little bit of hope, a little bit of light at the end of the tunnel, a bit of optimism about, yes, we can help you, we can move things forward. That's my sort of role. That's what I enjoy doing most of all.
So we try to create an environment here that is relaxed, that is open, that is supportive, and non-judgmental, because we know the variety of issues that people in recovery can experience, and we know that honesty is the only way that we can help people with that.
We're very clear with people right from the start that we don't share information that they give us with anybody, with employers or with family or friends, unless they specifically say that's okay. There are instances though, particularly if there's risk involved to themselves or others, that we'd have to share probably, and we always tell you that we're going to do that though. We would always tell somebody that we were going to have to share their information.
So depending on people's substance use, there's different ways that you can access our service. If the issue is primarily alcohol, then people can self-refer using our contact number. If it's primarily for issues around drug use, then there's a variety of ways they can get in touch with our open access service, either online, on the phone, or coming into the service and being signposted to the drop-in sessions for that.
We think about, of course, how brilliant it is that they've come to the end of their treatment, and that's always a bit of a celebration. But it is a time when we have to think about what happens next. And there's so many things you can do once you finish treatment. You can join other groups such as SMART or NA or AA, and they're kind of support groups where people have been in similar situations help each other. And they can do a whole host of things. We've got access to all sorts of wonderful projects like Shekinah Grow, where you can go and do gardening and create wonderful things, and we have creative groups, fishing groups, all sorts of things that I suppose connect people to other people, because part of staying in that place where you've got to is about being connected to other people in a really similar situation. But ultimately it's a great time of celebration, really.